Mexico has increased its COVID-19 vaccine donation to Jamaica to 65,000 doses. It previously announced that it would donate 35,000 doses. Now the shipment of the AstraZeneca vaccine is scheduled to arrive in Kingston tomorrow. Meanwhile, as the country remains on alert for the Delta and Brazilian variants of COVID-19, testing for all COVID-19 variants will soon be possible. As Shamela Pullen now reports, Health Minister Dr. Christopher Tufton says there are also plans to ramp up testing.
On Monday, Health Minister Dr. Christopher Tufton said while the Delta variant of COVID-19 is not in Jamaica, he believes it will get here at some point. So far, Delta has been detected in at least 92 countries, including the United States. As a result, Dr. Tufton says additional work is needed to test for the virus.
We're not doing tests for the specific strain, but we can know whether it's positive or not. What we have to test for is whether or not it's the Brazilian strain or the Indian strain. So we will know whether or not cases are increasing. And once cases start to move up and you start to get over the 1% reproductive rate or positivity rate beyond where we are, the ideal positivity rate would be about 5%. It's now a little over 7. Remember, it went up to about 38. So if you see it going over 10 and continuing to rise, then you know you have a problem and you have to work on that. So we have some triggers that we use and will use.
Dr. Tufton says the ministry is in the process of securing equipment to test for Delta as well as other new variants. However, Dr. Tufton says he can't give a specific timeline when the equipment will arrive in Jamaica, but it will be soon.
We have secured an agreement with CDC. And we're also looking to acquire another piece of equipment via Chase, and that will involve some training of personnel, and that will give us the capacity to test without having to send to Carrefour or elsewhere where those equipments now exist.
Beyond that, Dr. Tufton says the government has given private companies permission to carry out testing exercises for strains of the virus.
Where the private sector have been, about 10 companies I understand, have been given permission to do testing. And they have multiple locations. And I think that's important because you want persons to have that capacity, whether per individuals or companies. So we will try to ensure that testing is as available as possible. It's a little expensive in the private sector, but so the extent to which we have competition, hopefully the prices will come down.
Meanwhile, the World Health Organization, WHO, has updated its guidance on testing strategies to account for more transmissible variants. It says timely and accurate diagnostic testing is an essential tool in preventing and controlling the spread of COVID-19. The WHO also said testing should be followed by a strong public health response, including isolating those who test positive and providing them care, contact tracing, and quarantine of contacts. Shamela Pullen, TVJ News.